President Obama is being brainwashed by Nazi doctors. On May 3rd, the president was interviewed by the New York Times Magazine, and when asked about the administration's plan for health care, Obama said that he was actively seeking the counsel of Peter Horbag and holding discussions with him on comparative effectiveness research. What is Peter Horbag's comparative effectiveness research, you ask? Consider this scenario. You've now arrived at a hospital where you just got word from the doctors that your 76-year-old mother is terminally ill. The treatment for this illness exists, but it is very costly and must be administered over a long period of time, and it's not even certain that she will live past the next 8 months. You explain to the doctors that you want to do whatever it takes to save your mother, but you don't have the money. At this point, Peter Orszag's behaviorist accountants enter the room.
Comparative effectiveness research shows that the treatment may only give your mother a few more years of life, and for what it costs to do that, you might be better off telling your mother to call it quits.
As you rise to strangle the schmuck, he interjects.
Studies have shown we can drastically cut healthcare costs if you compare the effectiveness of the treatment the doctor prescribes for your mother and the alternate treatment, letting her die. Don't you see how much we'll save in healthcare costs?
Yeah, but you're going to kill millions of people this way.
But it's more cost effective. Even the president knows that cases like your mother account for 80% of public healthcare spending. They're old, ill, and won't be around long anyway. So it's a small sacrifice to balance the budget, right?
Much of this euthanasia policy has come from the Dartmouth Institute, which has written the main papers that Peter Orszag and others have been using to brainwash Obama. Most of these papers are long-winded diatribes on why we should kill off old people and ration healthcare, based on the assumption that you can give a dollar value to a human life. They have sought and achieved to some degree making popular practices like withholding nutrition and hydration from patients, and even irreversible sedation, murder, to reduced costs. The main funders and backers of this policy come from the Robert Wood Johnson Foundation and none other than George Soros's Open Society Institute's Project on Death in America. So what we have coming out of the Obama administration under the influence of Orszag and the behaviorists is nothing more than a repeat of the policies inflicted upon the Jewish people by the Nazis during the Holocaust of the 1930s. The Nazis, too, demanded more cost-effective methods for labor under the Hitler regime. Back then, we called it austerity. Why pay for these people to live, they said. We should only give them enough to keep them alive to perform the extreme labor we demand of them. We know that the average person requires at least 2,000 calories a day to survive, but if we give them 500, we can milk them, and when they waste away or get old, throw them into the gas chambers and begin the cycle all over again. Such is the outcome of monetarist thinking. So either we remove the influence of Peter Orszag, Larry Summers, and the other behaviorist scum around Obama, or you might soon hear an otherwise hesitant president firmly proclaim, "I'm sorry, but we can't afford to keep you alive."